Today, I would just like to briefly go over the educational requirements for acupuncturists in the United States. Anyway, I hope this information is helpful and when making your decision whether to choose an acupuncturist for as a healthcare provider. This is again about me. I have been a licensed acupuncturist since 2002. I do have a doctorate degree in acupuncture and Chinese medicine. I have also been a registered nurse since 2009 and currently hold my Bachelor of Science in Nursing and Holistic Nursing. I've also done some functional medicine training, including completion of the Institute for Functional Medicine's Applying Functional Medicine in Clinical Practice module. I have national board certification with the NCCAOM in Oriental Medicine, which includes acupuncture and herbal medicine together. And I also have some yoga and meditation certifications. So that's my training and background. Um, as far as the United States acupuncture education, a state licensure is required in 47 states, have practice acts for acupuncture practice. It's a minimum of a master's degree that includes traditional Chinese medical theory in addition to clinical practice hours. We also have to take several courses in biomedicine, which is part of the NCCAOM National Certification Examination, um, by the way. In terms of training hours, it is the longest master's degree in history. Um, once a bachelor's degree is typically required to enter the master's degree programs in acupuncture. The trainings are anywhere from 2 to 4 years, which differ depending on whether or not you are going to do herbal education or not. So the acupuncture only programs are a little shorter. The herbal medicine is a lot more complex, so they tend to be longer. So training hours similar to a nurse practitioner in the sense of division between classroom and clinical practice hour requirements. So the MAC, MTO, and MTCM is Masters in Acupuncture, Masters in Oriental or Chinese Medicine. The profession, just like nursing and other professions like physical therapy, is moving to doctorate at entry level. So if you see the acronyms DAC, DACM, DAOM, DAIM, these are doctorate level programs that vary. Some programs, the one I did is a DACM program focused on integrative healthcare. It was a little bit shorter, it was a transitional doctorate. Um, the DAOM programs are longer. Those are clinical research programs where graduates typically do some kind of graduate thesis, and they are focused on a clinical specialty. So it just depends on what you. I felt like as a nurse, I didn't really want to do that. Um, but so there's variations, but the minimum is this master's degree, and it's very similar to nurse practitioners. The scope of practice of acupuncturists is going to differ by state, and this is consistent across every other medical profession in the United States. So, practice acts related to acupuncture tend to focus on the use of the acupuncture needle because acupuncture needles are cleared by the FDA as a device, a medical device. Um, Typically, as a category, licensed acupuncturists are either specialty care or primary care provider status. I have an active California license, which makes me a primary care provider, meaning I can do reports for work comp, I can write letters for patients to excuse medical absences, and so forth. In Maryland, my license is specialty care, which generally means I can bill for insurance and see a patient independently. There's no other referral required from another practitioner, another healthcare provider. Um, Education requirements for acupuncturists can include herbal practice or not. And what determines that is the state scope of practice or the State Practice Act. Some states like California require herbal practice. Generally speaking, the West Coast states, the schools out there are typically modeled after Asian programs that they do in China, Japan, Korea. Um, the programs on the East Coast focused primarily on needle usage. So you could go to school to learn how to do the acupuncture needles, but they don't require that you learn the herbal component. As I said, the Practice Act typically focuses just on the needles. So there are varied reasons behind why a state would make that decision, but this is just um, my interpretation of it's not even my interpretation. This is just the requirements are going to depend upon what the decision makers decided when they were developing the Practice Act. Um, there are other healthcare providers who also provide acupuncture, and it's important to know that we don't all have the same training. Generally speaking, a license in any specific treatment or modality is going to be the highest level of licensure as compared to a certification. Certifications typically don't require, you sort of take some education and with proof that you took the class, you can receive a certification. Licensing typically requires things like background checks, um, licensing examinations. It's a higher standard and level of practice. So when we're just talking about acupuncture alone, the licensed providers are either practitioners of Oriental medicine, and again, these are people who've taken herbal and acupuncture training, or practitioners of acupuncture. These are people who learned the theory and just use needles alone. Um, Other healthcare providers can receive certification. The most rigorous certification that I am aware of currently, medical acupuncture, which is what physicians are required to take, is typically a 300-hour course. And there are several courses available to them. There's three off the top of my head. Um, There are states where medical doctors are not required to do any additional training to provide acupuncture, which breaks my heart a little bit. But for the most part, physicians uh, and also osteopaths, anybody at that MD level can take this 300-hour course and be certified to do acupuncture. Chiropractors and naturopaths have some chiropractors, it's very different depending on the state and their education. Naturopathic physicians typically take some, a lot of acupuncture theory, and some states allow naturopaths to provide acupuncture as part of their scope of practice. So that's actually different than a certification. But the amount of hours and training vary. It just depends on the state. Um, in my opinion, dry needling is a type of acupuncture. It's actually not just my opinion. The Centers for Medicare Services have determined that dry needling is acupuncture and is under the sole purview of acupuncturists. But I don't want to get into a big, there is a lot of debate about this. Um, but what I will say is dry needling is a certification to provide a type of acupuncture. It's a very distinct type, but it is the same. Um, the hours varies anywhere between 8 hours to 80 hours. Typically, it's going to be a physical therapist, an athletic trainer, or chiropractors who get certified in dry needling. Acupuncturists, dry needling is already within the scope of an acupuncturist, but you may have the techniques, there are differences in the techniques. So some acupuncturists will do some in the context of having to maintain our license through continuing education. We'll take some education in dry needling. Um, I see there's a typo. There is something called dry needle neural therapy, which is something that nurses have come up with. And then there are auricular treatments that a lot of varied healthcare providers, psychologists, people working in behavioral health can become a detox specialist. This is allowing acupuncture solely in the ear alone, and those treatments are typically protocols that do not require any level of diagnosis. Everybody gets the same treatment, so it's really just about putting the same 5 needles in everybody. So it varies across the board about who is able to needle, and it is, again, dependent upon their state practice act. But obviously, practitioners of Oriental medicine and acupuncture do have the highest levels of standards of training in needling and diagnosis as well. In terms of general practice types, this is for the licensed providers. There's a lot of different ways to learn acupuncture, and this might be new for some folks. 80% of acupuncture schools train in what we call TCM, or traditional Chinese medicine. This is a modern form of doing acupuncture that basically, in my opinion, was created um, as a model that is more integrative with Western medicine. It is an internal medicine paradigm. Um, it acknowledges that disease has internal and external causes, and herbal medicine is a big, big piece of it. Herbal medicine is the one part of acupuncture practice, if the acupuncturist has received training in this, which is rooted in biochemistry, similar to drug practice, right? Western medicine is um, relegated to drug treatment and surgery pretty much outside of the behavioral health models. Um, because of the strong herbal influence, TCM pairs very well as an internal medicine model. Um, and so this is what they're teaching pretty much in China nowadays. And it is a modern form of practicing acupuncture. Classical acupuncture is how acupuncture was practiced before TCM was developed. It is truly a holistic model that is strongly informed by nature, and it has a very strong spiritual and emotional influence with the theory. A lot of acupuncturists, myself included, will take continuing education to deepen our understanding of classical acupuncture. But for example, somebody whose practice is focusing on strictly pain management, they're not going to be focused on the classical techniques necessarily. And then there's something called five element acupuncture, which is the primary model that is practiced in the UK and Australia. It is, in my opinion, a model that is rooted in psychology. It is also, because of the primary school in the state of Maryland was a five element school, uh, a lot of Maryland acupuncturists who've been here for a long time are rooted in this five element practice. They have entirely separate methods of diagnosis and treatment. There's a gentleman named J.R. Worsley who's out of the UK who is the primary. I believe he developed this system of practice. Uh, it addresses, they claim that they address the person and not the symptoms. And the belief is that disease has internal origins, I'm sorry. So they diagnose what they call a causative factor that is rooted in one of the five elements. And what they will do is balance out that specific element belonging, which is the constitutional factor of that patient. And the belief is that by balancing out the element, all of the other symptoms will just kind of fade away. Um, to my knowledge, five element practice of acupuncture does not have any type of herbal practice involved, nor is it a great model, in my opinion, for pain management. It can be if the pain is rooted in like stored experience and trauma, but if you're working out a lot, you just tear your rotator cuff, it's not going to be the best model. Um, but these are the general different types of practice for an acupuncturist. Um, the medical acupuncture, orthopedic style, and dry needling or pain management types of acupuncture, which are the most prevalent in practice, I would say. Um, and then the NADA or the five needle protocol. I'm in Maryland working in a military hospital. There's also something called battlefield acupuncture. Um, battlefield is pain management, but these are strictly auricular programs. NADA is used for treatment of addiction. So basically, from a patient point of view, you're going to uh, need to decide if you want your acupuncturist to be more patient centered and holistic or more treatment centered and technical. It's really, for me, my personal belief is that there is a style for every patient, there is a provider for every patient, but I think people, in the interest of patients understanding what you're choosing, um, if you want something more holistic, I would choose a TCM provider or a five element or classical acupuncturist. If you want something like, dry needling, like I don't want to hear about chi or anything like that. I just want somebody to put needles in me and fix my problem. That's going to be more dry needling, um, or medical acupuncture, and so on. Um, Questions to ask when selecting an acupuncturist: you can ask if they accept insurance or not. What style do they practice, given that you just heard about the different styles? How much experience do they have treating a specific condition? There are other types of trainings and certifications that acupuncturists can take, so it's worth asking that. Ask them if they provide prescribed herbs or supplements, if that's something that you're interested in. Red flags for any healthcare provider: only see me, right? If somebody tells you to stop seeing your other healthcare providers, to me, that is a huge red flag. Uh, Most providers do not train across disciplines. So, the most common thing I see are physicians who say, don't get acupuncture for ABC, XYZ. To be fair, I think they're doing that out of an abundance of caution, but um, it's not a valid concern. It just isn't. Any provider that says only take the medications, herbs, or supplements that I provide you is a problem. Again, most people are not training across disciplines and they do not have the required knowledge to make such a decision or determination. There are certain cases where, for example, if you're doing an IVF protocol, it makes sense to only focus on the IVF protocol. And it doesn't make sense in that case to be taking any herbs. But most acupuncturists or practitioners of herbal medicine will know that. So they likely will not be prescribing herbs to you during those times. If they are, it's a red flag. Any unwillingness to consult with other members of your healthcare team, to me, that's a red flag. Your healthcare is your choice and your decision. Part of evidence based practice, it is supposed to be equally balanced between, people think evidence and research is the only part of it, but there's equal balance is supposed to be placed on the experience of the provider, is the second leg. The third leg is patient preference, whether it's a cultural preference, your individual preference. Um, your healthcare is your choice, always, just point blank, period. So if you have a physician or an acupuncturist who is bad mouthing other members of your healthcare team, to me, that's a red flag. Anyone who schedules treatments with no expected end date, I'll call that a yellow flag. Um, Acupuncturists understand that anybody walking through the door, we can find something to treat, right? So there is some logic to that. However, I think that the best providers will give you a treatment plan, will be able to explain to you, I expect this to get better in X amount of treatments. There's no guarantee, but what we'll do is at the end of this treatment course, we will evaluate your progress and take it from there, right, and adjust accordingly. And finally, you should have some kind of rapport with your provider. You should really be able to feel like you are heard and respected as a patient for your choices and what you feel like um, is important to you. So I'll just leave it at that. So I hope this has been useful. This presentation here is part of my All About Acupuncture webinar. If you would like, I offer that webinar. It is an hour long for free. And if you have any questions, you'll be able to ask questions. I do it as a Zoom webinar. You can go to the website and register for that. It's part of my belief and that it's a service that I'm providing for everyone to advance the practice of acupuncture and increase awareness in general. Good luck, and thanks for listening.